Hi, I'm Dr. Courtney Tracy. I'm known on the internet as the Truth Doctor, and today I'm going to be giving you a brief yet deep dive into depression and how to understand yourself more if you're struggling with it. Depression is when you're either feeling constantly sad or extremely disinterested in things that you used to enjoy or feel that you want to enjoy. While we all get like this sometimes, typically if these symptoms last for longer than 2 weeks and come along with other symptoms, then you may be headed towards or already experiencing depression. If you are experiencing depression, it does come along with other symptoms besides just being sad and uninterested in things. This is a huge misconception when it comes to depression because people who haven't ever been depressed often think that depression is just sadness or being disinterested, and that actually disconnects them from people that are experiencing depression because a lot more goes on than just that, and it can actually be pretty invalidating. There's a really long list of other symptoms that come along with depression besides just sadness and being disinterested. Some of those symptoms include feeling tired or lacking energy, feeling restless and irritable, general sleep issues like difficulty falling asleep or staying asleep, and perhaps oversleeping. Imagine wanting to sleep but not being able to, or wanting to get up and live your life and feeling like you just can't get out of bed. Other symptoms include feelings of hopelessness and helplessness, thinking things like, I have nothing going for me, or I am never going to get better. Also, people that are depressed can experience symptoms of difficulty making decisions, focusing on things, remembering things. And this really doesn't help with trying to be interested in new things. They may lose weight or gain weight due to eating pattern changes and experience other physical health issues like headaches, GI upset, and a lot more. So why do people get depressed? Well, there's literally millions of reasons why each and every one of us could get depressed, but there are some top underlying causes. And heads up, it's not just a chemical imbalance or genetics, even though those two things do play a part. Along with brain imbalances and genetics, depression can also be caused from mood dysregulation, impulse control issues, life events that cause chronic stress, whether they were traumatic or not, certain medications, certain medical conditions, other life events, and alcohol and drug use. Knowing that there are so many different causes to depression, it makes sense that there's so many different presentations of depression and therefore so many different treatments, tips, tools, and actionable takeaways that you can take from any video on YouTube that's discussing depression. So how are you supposed to know how to treat your own depression? Well, this is one of the major issues with the self-help advice that you find on the internet, including on all of my content. Those actionable takeaways, tips, and tools can be really difficult to apply to your specific situation. I've always tried to make these type of videos for my community, but it never felt like the right thing to do. Because what if you take the wrong tip or the wrong tool that doesn't actually apply to your symptoms and then feel like you can't get better? If you are looking for specific tips and tools, then they are all over the internet. But what I want to offer you today is some true advice on how to know who to go see and for what symptoms you're experiencing when it comes to depression, and also to figure out what those symptoms are for yourself. I want you to be able to take a look at your body, your mind, and your life and see, how is my depression showing up for me today? What is it that I'm going to need to do? Who should I see? What tips and tools should I take away that can actually help me to alleviate my depressive symptoms? Because we know that depression shows up in so many different aspects of your life, body, and mind, it can present in so many different ways, be caused from so many different things, and have so many different consequences. The first thing that I think that you should do is to try to learn how your depression actually shows up for you. And there's a few different ways to do that. Trying to figure this out on your own can be very difficult, especially when you're already feeling depressed, which is why it can be helpful to talk to your medical provider. And if you already have a mental health provider, then they can definitely be of assistance as well. If you don't have access to those types of providers, which I know is the case for many of you, then it's important for you to begin to assess the following areas of your life. And my recommendation is to keep a journal so that you can keep track of what it is that you find out. The first part of your life that I want you to assess is your physical body. Depression can show up as fatigue, muscle aches, headaches, stomach aches, nausea. You want to figure out, what symptoms do you have? When do they show up? What helps them? What doesn't help them when it comes to your exercise, sleep, food, and liquid intake? This is going to help give you an idea of how the depression is showing up for you in your body and how your body is responding to the depression. Next, Take a look at your mind. What thoughts are you having? What feelings are you having? What memories are coming up for you? What worries are you having? What are you not thinking about anymore that used to be helpful? How and when do these thoughts and feelings show up for you? Are they constant? Are they dependent on when something happens, like perhaps when you're looking at specific social media or when you're thinking about a certain person or a certain situation? Being able to know what goes on in your mind is extremely helpful. It can also be very overwhelming. And so if you have reached this step and you feel like it's overwhelming and you would like to be working with somebody on these things, then that's your call to go and talk to a professional. And lastly, depression doesn't just show up in your mind and body. It also shows up in your environment. So take a look. What does your room, bedroom, kitchen, bathroom, living room look like? Who do you talk to? Who do you connect with? Who knows the real you and can be helpful? And if that answer is no, and you feel like you don't have anybody, then I'm sorry for that, and I understand. Try checking out free online communities, perhaps on Facebook groups, for people that are looking for peer support and can offer you the peer advice that you need. Your environment really matters. Depression, again, is not just in your body and in your mind. What we feel internally gets expressed in our external environment. So if you're working with someone or you're working on yourself and you're thinking that you only need to look inside your body and your mind, you also need to see how is your environment contributing to your symptoms, or how are your symptoms affecting your environment? Remember, depression is a combination of so many different symptoms, and it's really important that you give yourself the time that you need to truly figure out how depression shows up for you. That way you can even know which coping skills you may find on the internet or in a different YouTube video that actually apply to how depression is showing up in your life. I hope to make more videos in the future going over specific coping skills for each specific symptom, but for now, I do hope that this helped. Remember, you have the ability to self-assess in a way to figure out what type of help it is that you need. Remember to like this video, comment your thoughts, subscribe to my channel so that you don't miss out on any of my videos, and get notifications so you can be the first to watch. Thanks for watching. See you next time.